But after 7 years of that, I started to get kind of a hitch in my spirit over the fact that patients really weren't getting well.
Oh,
And what I mean by that is I was prescribing the treatments I was trained. I mean, I was a highly trained physician, and if your blood sugar was up, I give you metformin. If your blood pressure's up, I give you hydrochlorothiazide or lisinopril. I mean, I knew if you had a migraine, Imitrex or whatever. I knew the pharmaceutical approach very well, but over the long haul, so people would get temporarily better. Their blood sugars would come down for a little bit, but over the long haul, over a year or two, it would creep up, whether it's blood pressure, blood sugar, joint pain, migraines, you name it, reflux. Over the long haul, things didn't go away. They weren't ever cured. We tried to manage them, but my management was always ultimately unsuccessful, meaning they just always needed more, higher dose and more meds, and nothing got all the way better. So that was 7 years ago when I was introduced through a divine appointment. A nurse practitioner at the time met an integrative functional type of doctor and opened my eyes to this other realm that I never knew existed. And I think a lot of people don't know exists. There's root causes to people's problems. I think intuitively we know that. But if your doctor doesn't know it, and you go to your doctor when you're sick and he was trained in a certain way that treats a symptom with a pharmaceutical, it's just hard to wrap your mind around the fact there could be something more. But this doctor convinced me there was something more, and ultimately I sent him my 10 sickest patients, and they all came back better, and these were the worst of the worst. They've been to all the specialists, they've been to the medical school specialist, and fibromyalgia and lupus and other autoimmune diseases and chronic prostatitis and chronic urticaria and brittle diabetics, and they all came back better, most of them all the way better and off their meds.